Hello, everyone. So you guys saw me dancing to our theme song, which you guys cannot hear. Forgive me. Now let's give a round of applause. You're welcome to S-Hub. Thank you so much. You guys are too kind. You two guys are too kind. You're welcome to S-Hub Clinic. Sex in the City, the only podcast that talks about sex. I always say this. It's the only podcast on the planet that talks about sex as it is. And it is Sex in the City. Today we are not going to talk about sex. We are going to talk about a very important topic that is a result of sex. We are going to talk about children, babies, newly born babies. These are the kind of people we are going to talk about today. And I want to encourage you to join us to the end because we are going to point out a lot of things, especially if you're a new mother. We are going to point out a lot of things that you need to know. This month is the Yellow Month. It's entitled the Yellow Month because it's a month dedicated to raising awareness about newborn jaundice. Jaundice in newborn babies. Have you ever heard of jaundice before? I remember a song that goes like this. Aponchi say Obama jaundice a drash and the Johnson. Gone were the days. These songs were sung in time past. But jaundice is real. And unfortunately, late treatment of jaundice or late identification of jaundice and untreated jaundice is leading to a lot of complications in newborn children. In fact, I heard from our celebrity doctor that if jaundice is not treated in time, it can end up in cerebral palsy. Very, very dangerous diseases that can alter the life of a newborn baby forever because of jaundice. Today, that's what we are going to talk about. And I want to encourage you to stick with me. I want to encourage you to share the link. Share it right now. Share it with someone. Share the link. Share it with someone and let the person join us as we talk about newborn jaundice. At this time, I want to bring in our celebrity doctor. Let's give her a round of applause. Hello, our celebrity doctor.
Hello.
How are you doing today?
I'm doing very well. Very well today.
We thank God so much. How have been your day? How have you been celebrating your weekend and your enjoyment? Pleasant, eh? The way you said the pleasant doesn't sound pleasant at all.
How for do? But in all, it has been pleasant.
It has been pleasant, eh? Wow.
Yes.
So, tell us, what do you have for us today?
Today we are going to talk about neonatal jaundice.
Neonatal.
Yes.
Wow.
Jaundice in the newborn.
Okay.
And then we are going to look at overview. Okay. This whole month is dedicated as Yellow Month or Neonatal Jaundice Month, okay? So we are not going to bore you with a lot of information today. Today we just want to create the awareness, a few tips, and then a subsequent podcast will come back with detailed presentations as to a lot of things pertaining to neonatal jaundice. So as you can see, I am in my yellow, and we are painting everywhere yellow month yellow every day. In fact, if I had a chance, every day I'll wear an attire with yellow.
Why?
Yes, just to re-echo and re-emphasize the importance of neonatal jaundice, and then taking appropriate actions to navigate through the consequences that it can occur to the newborn and then the family.
So, what is neonatal jaundice?
Okay, so neonatal jaundice, these are two words, okay? We have neonates and we have jaundice. So, like I said before, when we said neonates are children or newborns from the ages of 0 to 28 days of life. Okay, those are neonates. And then jaundice. So jaundice is just yellowish discoloration of the skin. Okay, the eyes, the sclera, which is a whitish part of the eye. Okay, and then the mucous membrane of the child or the newborn baby. So as you can see, my attire, wearing my attire yellow. Either the whitish part of the baby is yellow, or the mucous membrane, the mouth, or the whole skin, entire skin from head to toe is yellow. So that is what we call jaundice. Okay, so this as a result of something we call hyperbilirubinemia, or excessive levels of bilirubin in the system. I'll break it down, don't worry. When we talk of the bilirubin is just yellow pigment. Okay, when there is a breakdown of your red blood cells, it produces the normal byproduct of the red blood cell cycle is what we call the bilirubin. It's a yellow pigment. So when we talk of hyperbilirubinemia or excessive bilirubin, it means that this yellow pigment, which is the bilirubin, which is produced as a result of the breakdown of the red blood cells, is too much for the body to carry. And that is what you see it resulting in the jaundice that we talk about. So basically, that is what neonatal jaundice is all about. Yes.
Okay. So doctor.
Yes.
How do you identify such a thing? I know that you have talked about the mucous membrane, the eyes of the baby being yellow.
Yes.
Are they the only ways to identify it?
Yes. The ways to identify, the first foremost ways to identify is looking at the skin or the eye of the baby. Okay, I don't know if you have a picture that shows the eyes of the baby. Okay, all right. But if you can see this picture, if you can zoom it for us, we have different shades of the babies. Okay, different shades of the babies. But the current picture that we have, as you can see, which one are you showing? Let me have a look at it. Okay, so you can see on our screen we have different shades. Somebody will say that my baby is not fair, my baby is dark. Somebody will say my baby is chocolate. So we have brought two different colors. Then you choose from the one that suits your baby. Okay, so looking at this picture, you can see we have two sections. The part that it has no jaundice and the part that has jaundice. We brought this picture because, you know, sometimes when the children are very dark or when they are very fair, it's difficult to easily identify jaundice in them. And so by the time you notice that the child has jaundice, then it means the jaundice has spread all over the body and may have a potential of causing dangerous effects on the baby. So you can see the picture starting from a baby that is fair, like me. You see the part that we have no jaundice, and then the part that we have no jaundice, like this, and then the part that has a jaundice. Look at this black baby. This part has no jaundice, and this part has a jaundice. You see how difficult it is? It's just like a slight distinct for you to see in between. So normally the eyes, the whitish part of the eye will become yellow, which is the sclera. You see that it is not white as it is supposed to be, but it is yellow. Then you realize that the skin, there is something we say that the spread of jaundice is cephalocaudal. It means that it spreads from head to toe. It spreads from head to toe. So you start seeing it that the baby's face is yellow. You realize that the whitish part is yellow. Sometimes when you use your thumb to press on the nose of the baby or on the skin of the baby, you realize that the patch of your or indent of your finger will be on the skin and it will be yellow, as you can see in the picture that we have. So you see that when you look at the normal picture, you may not even know that this baby has jaundice until you press it down before you see. So it starts from the head and then it spreads up to the feet of the baby. So that is one way to identify, and that is the first sign that a lot of people, because the other ones are done at a clinical setting. So for a mother, when you give birth, you must know that neonatal jaundice is very common now. At least about 3 out of every 5 children will have a jaundice. So the sensitization that we want to do today is that be observant, okay? When you have birth, when you give birth, whether through CS or through normal vaginal delivery, please, at least for the first 5 days of life or within the first 2 weeks of life, be very, very vigilant. Assess your baby. Most of the times, we wrap the babies and then put the babies in a room, and the room has no good source of light. So we are not able to identify the jaundice very, very early until we bring the babies out before you realize that the skins are yellow. But if you take this sensitization, as I am saying, every other now and then, you bring the baby out to the normal sunlight and thoroughly examine to be sure that your baby is not jaundiced.
Okay, so Doc, if I understand you,
yes,
1 out of every 3 baby, right?
3 out of every 5 babies will jaundice. It's very common.
Okay, 3 out of every 5 babies,
yes,
meaning that it's very, very, very common.
No, jaundice is very common in a newborn.
So every mother should take it that yes, my child may have jaundice. So yes, every time be checking for it.
Yes, especially within the first 5 days to 2 weeks of life. Be
checking, sure, always yes, be checking. Every day you take your child, yes, make sure that you bring her to or him to light, check the eyes, press the skin to see if it is yellow. And if you see anything that you don't really understand, or
please come to the
quickly
hospital.
Go to the hospital. Don't wait for it.
Don't wait for it.
Yeah. Wow. So what are some of the effects of jaundice?
Before we come to the effects of jaundice, I want us to know that, sometimes I want to take this particular part because of how approach to jaundice has been. We have 2 types of jaundice, which are the physiological jaundice, and then we have what we call the pathological jaundice. The physiological, I'm going to take you through this because most of the people, when the children have jaundice, they'll just say that, it's because the child doesn't have enough breast milk, so just give breast milk to go, give breast milk it will go. Or sometimes they'll say, it's normal, put the child at the sunlight, it will go, okay? But you must know that we have 2 types of jaundice, which is a physiological and then a pathological. The physiological one is just as a result of normal processes that occur in the baby's body that may predispose the baby to have a jaundice. Then the pathological one is actually as a result of a disease condition that is present that is causing the child to have jaundice. Okay, so to have jaundice. So for the physiological one, some of the causes may be either there is too much production of the red blood cells in the system of the baby. We call it polycythemia. So red blood cells are so much that as they break down, they produces a lot of the byproduct, which is a yellow pigment, which is a bilirubin, and therefore they become too much excessive in the body that the body is not able to excrete all of them, and therefore you have a jaundice. Then the second one is either the lifespan of the red blood cells is very short. God has designed it that the red blood cells takes about 120 days for it to be broken down. But in newborns, this lifespan will be shorter than the 120 days. So it means that there is a quicker breakdown and turnover of the red blood cells. And that also is going to cause the amount of the red blood cells to increase. Mind you, before high levels of bilirubin that causes jaundice to occur, is either there is so much production of that yellow pigment or there is a lower excretion of it from the body. Okay, so what I have described now is one of the causes that you have increased levels of it. Then when it comes to another medium of which the physiological ones occur is either the baby's liver is not mature. The liver plays a very major role in the breakdown or metabolism of this bilirubin. Okay, so what the liver does is that as the body produces the bilirubin as a result of breakdown of the red blood cells, then the liver also converts the bilirubin, which is more of like a fat, soluble into water form, so that it can be easily excreted from the body, either through the urine or through the stool, through the poop. Do you get it? So that is what the role of the liver happens. But most of the newborn babies, naturally, their liver is not grown, it's not mature to be able to handle that process. So they are not able to let the bilirubin undergo that metabolism, convert it to a water form to be easily excreted, and that also can lead to build up of this yellow pigment, which is the bilirubin in the body, and to give you jaundice. Now, when it comes to the pathological one, it means that we have a disease condition that is causing it. Okay, the disease condition that can cause it, we have a lot of forms of it. We have some of them that causes excessive breakdown of the red blood cells. One of them is what we call the ABO incompatibility. Let me just break it down. Every pregnant woman, when you go as part of your antenatal labs, you realize that they'll check your blood group for you. Is that not it? When they check the blood group, it's either you are O, you are A, you are B, you are AB. Is that not it? And then also they'll tell you that there is something called positive or negative. So it will either be you are A positive, A negative, B positive, B negative, O positive, or O negative. Now, when it comes to the ABO incompatibility, the mother's blood group is O, and then the baby's blood group is either A, B, or AB, and therefore they'll be fighting each other. The mother's O will be fighting the baby's A, B, or AB, and that incompatibility will result in excessive breakdown of the red blood cells, and that will give you your baby jaundice. Then also, when it comes to the results, which is a positive, if the mother is negative and the baby is positive, that one also there will be fight between these two, and that will also lead to the breakdown of the red blood cells, and you have your jaundice. Then another most common one is something we call enzyme defect. Okay, one of the common enzyme defect is G6PD. G6PD it's a very big word, glucose 6-phosphate dehydrogenase. Let me not bother you. The only thing is that it is a substance or an enzyme, and this substance role is to protect the membrane of the red blood cells to prevent it from breaking down excessively. But there are some people, either they don't have at all or partially have this enzyme or this substance we are talking about. So it poses your red blood cells to a lot of stress to be broken down very, very, very easily. Then also other things that can cause this is infection. If the baby has an infection, it can also cause this thing. Then also we have what we call breastfeeding jaundice. Okay, that is maybe a mother who have gone through, and this is very common. That is why we said neonatal jaundice is very common. Most women after delivery, either they complain that the breast milk is not flowing. Have you heard of that complaint? Have it happened to you? Especially those who have after cesarean section, and even some mothers after vaginal delivery, you realize that the breast milk is not flowing. So within the first days of life, you realize that the child is not having enough breast milk, and the dehydration that comes with it causes the red blood cells to be broken down, and then you have this jaundice. Okay, that is why you hear a lot of people saying that, oh, when a baby is jaundice, just give breast milk, to go. But today we are learning that it is not all about just giving breast milk. Some of them may be as a result of a disease condition that need to be handled. Other than that, the jaundice will not go, and then it will cause a lot of effects. Then there is another one that we call breast milk jaundice. Okay, we have certain enzymes that the baby or the mother may not have to break down certain components of the breast milk, and that one also will cause jaundice. So basically, just for today, that is what I will talk about. And then I just want to mention that we have surgical causes of the jaundice. Okay, sometimes the tree of which the bowel the bowel or the bilirubin have to pass through sometimes, and a lot of things can happen. Either the tree is blocked, or as a congenital during the developmental process, the opening or the tree is not patent, and therefore you have a problem with excretion of this bowel, and then you have jaundice. Okay, these are surgical causes. Within that, I will deal with it, so you can realize that jaundice is not just the jaundice you just say, oh, it will clear and that is all. Every jaundice in the newborn have to be duly investigated, very and thoroughly investigated, to be sure that this jaundice is not suicidal. This jaundice is not dangerous to the health of the baby. To the health.
Wow. As for this one, we have gone through medical school. I want you to replay this video again and actually listen to it again. Me, I got lost in the middle somewhere. I totally got lost in the middle somewhere because the words that were coming was very big. I have to rewatch it again. Yes, I have to really rewatch it again. I would like our doctor to just briefly touch on some of the complications of jaundice, and then we'll bring it to a close today. Yes. In fact, today is just an introduction to the whole topic of jaundice. We just want you to know that jaundice is there. It is a problem. It has dangers, and you as a mother, you have to take note of it and be checking your baby regularly. Right. Be checking your baby regularly. Okay. And we also want to let you know that there is still hope, there is still treatment, okay? So I'll let Dr. touch on the complications, and then we'll bring it to an end today. And then we'll continue next week. So please, mark it on your calendar, share this broadcast, and join us next week. So Doc,
yes,
what are some of the complications?
Yes, so this yellow pigment, which is the bilirubin, we have two types, okay? We call them direct and indirect bilirubin. I'll not bother you with it, but one of the things that jaundice can cause is that it has the potential of crossing the blood-brain barrier and going into your brain and affecting your child. When this jaundice cross into the brain, you know, God have designed the brain that it is protective so that you don't have things crossing into it to be causing effect. But there is a type of the bilirubin, okay, that one is high with fat, and the barriers within the brain are also fat loving, so they create a room for them to cross easily to the brain. All right, so when they cross to the brain, they cause a lot of effect. They damage the brain, and they can cause what we call the cerebral palsy. In fact, jaundice is one of the 100% preventable causes of cerebral palsy. When I see children that have cerebral palsy as a result of a complicated jaundice, in fact, I'm so saddened. I'm so sad because this is something that could have been easily prevented. So that is one of the major damage to the brain. Then aside the damage to the brain, if we come to the surgical ones, the surgical jaundice, whereby it can damage the child's liver, and unless a liver transplant, this child cannot survive. It can damage the liver, that the child, to the extent that the liver will fail totally unless there is a transplant. Jaundice can do this. Then also, we're asking how you can identify. We just want to tell mothers that, one, if you deliver and then within the first 5 days, first 2 weeks of life, please monitor. And then to our health workers, monitor. You know, there is this system whereby, especially those who have delivered through vagina, within 6 hours, they have discharged the mothers if they are fine. At most 24 hours. So we are even thinking, should mothers be placed on admission for an extended period so that we'll be able to observe them totally. But you know, our hospitals and turnover, when we keep you, others are also waiting to occupy the bed, okay? But we are sensitizing you that whether you deliver and you are going home in 6 days or in 24 hours or even 3 days, you the mother who is a primary caregiver, you have a responsibility to watch out of jaundice in your baby. And then when you come home and the child has jaundice, and they said, oh, just breastfeed, there are certain things you want to watch out for. One, is the child feeding well, or all of a sudden the child is no longer feeding well? All of a sudden the child behaves very weak, or something we call lethargic, as if the child is drowsy. Sometimes the child, it can even have what we call seizures or convulsions, okay? They say it in trees, all right? And also maybe the jaundice that have started from the eye, you are observing it, and all of a sudden it spread from the whole body, and you can even see the jaundice to the feet. It means that is a severe form of jaundice. So quickly you come, and then when you come, we have things we do. We want to sensitize every health worker that for a mother to come to the hospital with a complaint of jaundice, please don't just disabuse it. For me, it has happened to me. I remembered I had my baby. I jaundice. I sent my baby. They were like, oh, it's fair. It's just a color. I said, no, my baby is jaundiced. Because I know I have been handling babies with jaundice and saving their lives, not today. And truly, when they tested, they realized that no, the child has jaundice. So if a mother comes to you, don't just say, oh, go and breastfeed. So far as she has come to you to the hospital that my baby is jaundice, please, if your facility can do the basic serum bilirubin test, or you have the machine, which is the TCB, that the advanced ones have, at least basic SBR, please do it for this mother and be sure that the bilirubin levels are not higher above limits that will cause a problem to the child. It is just do that due diligence. And if you do it and you realize that no, we have charts, okay, we'll go into it. We have charts that we can plot to tell that, oh, this baby needs to be under phototherapy or not, treatment or not, this baby needs to be hospitalized or not. They are all things that, so do the due diligence and at least do this basic lab to check the level of the bilirubin in the system. It will give you all the components, whether it is direct, indirect, and the total bilirubin. Then you'll be able to take an informed choice. Don't let this mother go home with the information that continue breastfeeding and continue breastfeeding. No. And even if you check and the levels are low, you must tell the mother the danger signs that the mother should rush back immediately to the hospital. So I'm going to conclude by giving you my personal story. When my baby was born and had a jaundice, we had a treatment of phototherapy whereby we put the baby under the light. You can see it, and this light is a UV light. So the purpose is to convert the fat bilirubin into a water form that can be easily excreted from the body. So we did the first time and the baby was fine. We came home. We are supposed to come again in 3 days, but I observed that the baby was becoming more jaundice. I took the baby outside and I realized that jaundice all over. Immediately I requested to have an urgent SBR done, and lo and behold, it was so much above, even above the level of phototherapy that we need to quickly rush this baby for advanced care. So please, it is very, very important. Today is fine and very, very healthy, and very, very healthy. Okay, so it is very important that you identify the signs, and then you do not treat every jaundice as just causing or due to low levels of breast milk. We'll be coming your way on subsequent videos and then explanations on the various courses, the surgical ones and everything, and then you'll be more informed. On this note, we want to say that we are painting the whole country yellow, and from today, get a yellow dress and wear. We want to also appeal to you. We'll be talking more about it in the next broadcast, but I just want to mention it. If God willing, this month is also menstrual hygiene month, okay, on the 28th of May, And therefore, as SHAP Clinic, we want to go on an outreach. The last time we were in the Upper West region. So this time we are moving to the Volta region, and the exact place to be communicated during our subsequent post. But all that we want to do is that we want you to support us, to donate, to be able to provide free sanitary pads to at least 1,000 girls, so that they'll be able to own their cycle and own their own health in confidence. Thank you so much for having us.
Thank you so much, guys. As we always say, share the broadcast. Share the broadcast. Share the broadcast. Thank you so much. Bye-bye. Bye.